So if I go back to wave one, what we saw pretty much immediately was a drying up of our referrals, probably down to 10 to 20% of what they were previously. But we also saw our capacity shrink to probably about 80%. And that was driven by sort of staff absences, whether that was COVID related or other aspects, mainly COVID related. That was a factor there. So we pretty rapidly, given, I suppose, the infection prevention control regulations and all the rest of it, had to really radically transition into a new service model very quickly. And where we are at the moment with that, and have been since sort of March time, is that probably about 50% of our activity in the community is now virtual. And that's by means of both digital platforms and phone-based services. We use the Attend Anywhere platform. We're probably just about the largest or second largest user of that service in the country at the moment, doing about between 8,000 and 9,000 consultations a month through Attend Anywhere, which has seen actually a really positive reception. So about 90% of patients that have used that have indicated that they either think it's been a good or very good experience. So that's something that will probably stay with us in the future.
Were you using much of that virtual consultation previously?
Very little.
Yeah.
Very little. There would have been a bit of telephone activity, and we particularly through things like our crisis services and those sorts of things, we would have run a minimal amount of telephone-based work. So that's quite a transformation for us, and it's enabled us obviously to work with staff who are based in their own homes. And people who are shielding have been able to do that sort of work, as well as other members of the workforce who are kind of working flexibly between the community and our bases. So that's been quite a turnaround for us, and as I say, something that I think we've learned a lot from, and I think we perceive as being really beneficial and something that we would want to offer as a kind of hybrid approach to the delivery of community services in the future. It's not appropriate for everybody. It does have its limitations, but actually, in terms of having that in our locker, if you like, but as an option for people to choose, then we think that it's got a sort of strong future.